not following the prevention methods, the infection prevention and control measures, then that is when you will have outbreaks. So the government has decided that we will increase the curfew hours. Presently, the curfew for the island is from 5 a.m. to 11 p.m., which we usually say the other way around. So the curfew would start at 11 p.m. and end at 5 a.m. the following day. What we are going to do for the parish of St. Thomas is that we will increase the curfew hours. The curfew hours, therefore, for the parish of St. Thomas will be from 7 p.m. to 5 a.m. the following morning. We will have this new curfew instituted to restrict movement as of tomorrow. So as of August the 18th, the curfew for St. Thomas will be 7 p.m. to 5 a.m. the next morning for every morning and every evening for the next 2 weeks. We're also taking measures to restrict activities within the parish of St. Thomas. So we're saying now, which will be in the new order, there will be no funeral services at churches. Unfortunately, wedding ceremonies would be affected as well. Entertainment would be affected as well, and civic services would be affected. And this is for the next 2 weeks, starting tomorrow. Please note as well that we are monitoring communities, not just in Clarendon and in St. Thomas. We're also monitoring communities in Kingston and St. Andrew, where we are seeing a number of active cases emerging, and we considered carefully because we know the stigma that can be placed on communities when they are named. But we have to weigh that with ensuring that the residents in these communities understand the threat and take the necessary precautions. We cannot always return to lockdowns. We cannot always return to shutting down the country. We have to learn to live with COVID. And the way to live with COVID is for every single Jamaican to responsibly, faithfully, and consistently follow the infection prevention and control measures. And we know what these are. If you're going out in public, wear your mask. If you have to take public transportation, wear your mask. If you are ill with flu-like symptoms, respiratory challenges, if you're coughing, sneezing, stay at home. Reach out to the health services. If you are in a gathering of no more than 20, that should be, then ensure that you maintain social distance. If you're attending an event, the organizers of the event, they have a duty to ensure that chairs and tables are physically distant to ensure that people are not in close quarters. If you touch unknown surfaces, but even if you don't, wash your hands regularly, sanitize your hands if you can't wash them immediately. These measures work, and I can only encourage our Jamaican citizens to follow them faithfully and consistently. So the Ministry of Health has advised the Cabinet of concerns in the following communities: Duhaney Park, Patrick City, or rather Patrick Gardens, Pembroke Hall, Corryville, New Haven, the Halfway Tree area, Hughenden, Arlene Gardens, Malines Gardens, State Gardens, Zadie Gardens, Constant Spring, Barbican, Meadowbrook, Havendale, Delacree Park, Olympic Gardens, and Waltham Gardens. We're asking residents in these communities to exercise even greater care. Wear your masks, social distance, wash your hands or sanitize regularly. If you're ill, stay home. Make contact with your health service providers. We will be monitoring these communities very closely. And the reason for this, obviously, is that cases have popped up which have not been epidemiologically linked, meaning that they can't trace the source. Not that there are many cases, but the fact that you have seen a case where you can't trace the source could suggest that there is a general spread and you want to be sure. So we are being very cautious. We're being very upfront with the public to tell you what the threat is so you can act responsibly. I'll close my presentation just quickly to say that tomorrow is nomination day. I have today spoken with the Leader of the Opposition and I have informed the members of Parliament for the areas in St. Thomas and Clarendon that are affected. We have agreed that as leaders of the country, we will be scrupulous in following the rules, that we will be consistent and firm in ensuring that our supporters follow the rules, that how we organize the activities for the day are consistent with the agreement and measures recommended by the Ministry of Health, and which both parties would have agreed to, and was published by the political ombudsman. This is against the backdrop of what is happening in St. Thomas. It means that the political parties must exercise great care and caution, that our supporters must understand that we cannot conduct a campaign in the routine, normal way, that this campaign is a COVID-19 campaign, that the protocols must and will be strictly observed. I'll invite the Minister of Health to give further details.
Thank you, Prime Minister. So I'm going to just read from a statement. The country, of course, is aware, as said by the Prime Minister, that through the Ministry of Health's ongoing monitoring and surveillance for COVID-19, that we have these quarantine communities which are going to be extended for an additional 2 weeks. St. Thomas communities, Bamboo River, Church Corner, and Lower Summit. To date, the Ministry of Health and Wellness has conducted more than 300 home visits and collected in these communities some 700 samples. Based on test results received, we can now report that approximately 89 persons have been identified as being positive for COVID-19. 45 of that number are within the quarantine area. The surveillance activities has also identified more symptomatic persons who have been tested and are awaiting results. So the combination of the positive cases within the quarantine zone and positive cases outside of the quarantine zone, plus additional tests that are being done from persons who are symptomatic, has caused us to be more concerned about that parish, hence the measures that the Honourable Prime Minister has announced. So the evidence points to continued transmission. That's the general conclusion of the health team of the disease within these communities, and therefore, in order to manage the risk associated with the spread or potential spread, we've agreed for the extension for an additional 14 days from the 20th of August to the 2nd of September. Additionally, approximately 20 communities within the parish of St. Thomas have been impacted with new COVID-19 cases. These communities span the entire length of the parish and therefore indicates a sort of community transmission, if you will, that are some epidemiologically linked, others not, and hence the need for a greater level of alertness and concern and the measures that have been announced. In order to, well, the Prime Minister has announced the new curfew hours. That's 11 p.m. to 5 a.m. From 11 p.m. to 5 a.m. to 7 p.m. to 5 a.m. for the next 14 days. And of course, spoken to gatherings such as funeral services and so on not being allowed beyond 15 persons. The Ministry of Health and Wellness has also advised that there are additional communities of concern within the parish and that measures will be recommended to manage the spread in these areas. And as was said by the Prime Minister, in the next few days, with better particulars on these communities being made available, it's an ongoing effort, then the Cabinet will consider and take the appropriate decisions which will be announced in the form of an order. For Clarendon, the quarantine area in Clarendon, Sandy Bay and adjoining communities also seeing new cases of persons with symptoms. To date, the ministry has advised that their surveillance has covered more than 900 householders with more than 2,000 individuals interviewed. And based on the testing that has been done, some 22 persons have been identified as COVID positive. And of course, this scenario, based on the risk assessment, indicates and has caused us to conclude, the health team that is, that a recommendation be given for an extension of the quarantine area. So again, concerns there, and we're continuing to monitor and to collect information, and will advise in more details as to the specific communities, if additional communities are to be added. The Prime Minister has outlined the communities in Kingston and St. Andrew. This is concerning to us, and let me just emphasize again, as said by the Honourable Prime Minister, that the challenge we have with the cases that are popping up in some of these communities is that these are persons who present to their health centers and hospitals with symptoms. So it's not that they were in quarantine in most cases and then they have symptoms. They present because they are ill, and out of the testing, they are diagnosed, of course, as being positive. The challenge with that, of course, is that it now requires contact tracing, because in the immediate course of the positive diagnosis, there is no link to a positive case. It's a significant amount of work that has to be done, but the challenge, of course, is that they could have been in touch and contacting many other persons, their friends, families, communities, and by extension, therefore, the possibility of spread could be a very real one. So I'll just, for emphasis, mention the communities again. So it's Duhaney Park, Patrick Gardens, Pembroke Hall, Corville, New Haven, Halfway Tree area, Hewenden, Arlene Gardens, Malines Gardens, State Gardens, Zadie Gardens, Constant Spring, Barbican, Meadowbrook, Havendale, Delacree Park, Olympic Gardens, and Waltham Gardens. And again, it's not an issue of large numbers, right? So I don't want the public to interpret this as having multiple cases. It really is an issue of cases that are presenting, which now requires contact tracing, and the possibility, the chances of other persons being contaminated based on the movement of these individuals in these communities is a very real one. And the history of the virus suggests that that is the case. In the case of St. Thomas, it was a person in St. Catherine who visited friends and family in St. Thomas that created the spiral that led to the quarantining of these communities, and now we see significant others taking place. So it only takes one person, and that information is to be had on these individuals over time. But what we say to these communities, members in these communities, please take the necessary precaution. As the Prime Minister said, wear your mask, hand sanitize, maintain the physical distancing, standard procedures. It should become now the new norm. And it's important to be transparent about this so we are aware and that we take the necessary precaution. Again, over the next few days, maybe a week or so, we will provide as much information as we have on these communities or on individuals, just to keep the public informed. And I just want to emphasize from a public health perspective, in light of any activity that you partake in, of course, the extraordinary activity being our elections, that we take all the necessary precautions so that we protect ourselves and protect others. Thank you, Prime Minister.
Thank you, Minister Tufton. Just for clarity, as it relates to civic gatherings and social gatherings in St. Thomas, we're saying no funeral services. Burials may take place, but the restriction of 15 persons, inclusive of the burial attendants and the pastoral delegation. That is the limit. There will be, in effect tomorrow, a curfew starting at 7 p.m. So nomination day activities, which don't normally go up to that time, should be finished with enough time for persons to return home. This is the way in which we will have to live. It is not the most convenient way. It is very disruptive. But we find that it still allows life to continue, the economy to continue to grow, to recover, whilst we as a people internalize and start to model the behavior that will allow us to live with this virus.
Often we've seen, following up on Kirk's question, we've seen Trinidad, Ghana says they're not opening September 7th. We've seen Trinidad saying school is unlikely for the rest of the year. As you continue to monitor, as you said, is that something that is being actively considered? And two, in terms of all the information.
The likelihood of a postponement or delay are real, and I don't think anyone would disagree with that as a possibility, because ultimately the health and wellness and the health and safety of our children and indeed our population would be paramount. But it has to be dependent on the public health assessment of the risks and a recommendation that would advise accordingly. And that is an ongoing, almost daily activity. We assess and we discuss every single day, multiple times of day. And if we have to advise the cabinet, either under extraordinary circumstances or otherwise, we do so. So as of now, I'm sorry I'm being vague. I can say that there are concerns as it relates to the cases that we have seen, which is why we're here and announcing communities and quarantining communities. If the trend continues, it could be a challenge, but I will await some more time and assessment, and then the cabinet, of course, will make the decision. And I'm sure the Minister of Education will speak accordingly.